Hey everybody, Dr. Anthony here from Mossuto Chiropractic, and today we're going to be talking about scoliosis. It's a really common condition that we specialize in treating here in our office. People come in for a couple different reasons with it. Some who have been just diagnosed with scoliosis and told that there's really no path or no way to deal with it and they just kind of have to live with it. And other people who might be coming in with some of the signs and symptoms, the discomforts, or the pains, and they really have no idea that they do have scoliosis. So in our office, we want to go through thorough examination. We'll take some x-rays to really see if there is some underlying conditions that are dealing with curvatures of their spine, otherwise known as scoliosis. So scoliosis signs and symptoms that I'm looking for in our office. So we're going to do a physical exam as well as postural exam. So I'm looking for those asymmetrical postural findings, one shoulder being higher than another, leg length inequalities, as well as hip unleveling. Some of the other things that I'm going to be looking for that give me a great indication as to if scoliosis is present is going to be muscle tone asymmetry, or for you guys, it's really just going to feel like one side's a lot tighter than the other. That's due to the gravity and the way that your spine is taking on gravity or reacting to gravity. If it's doing it asymmetrically due to your spine, we're going to see that within the muscles as well. When it comes to treating it in our office, there's a lot of different things that we can do. One of the things is chiropractic care. As we restore mobility, it's going to decrease a lot of the symptoms, allow for more mobility in those areas. And then on top of that, there needs to be some sort of a rehabilitation component. So we do very specific muscle rehabilitation in our office to help upregulate certain muscles that have been not used as often, and as well as start to downregulate or help become other muscles that are overactive become less tight, less noticeable. Another really common thing that we'll find with our female patients who come in with scoliosis is that if they've had a child already and they had an epidural given to them, is that we'll usually ask if they missed with the epidural or if they had to do it 2, 3, or 4 times to finally get it into their spinal cord. That's really common because when we do have curvatures in the low back, it's not going to be normal or straight up and down. So sometimes that technician who's giving you that epidural will actually miss. So if they had to do an epidural a few times for you, it might be an indication that there's some spinal curvatures lying beneath that cause that ultimately for you. So if you've been experiencing any of the symptoms or signs that we talked about today, come on into the office. We'll do an in-depth consultation, examination, as well as taking some x-rays to really see what's going on beneath the surface. It'll most likely help you understand what's going on inside to make sure that we can put a plan together and minimize the way this is affecting you so you can truly live your best life.